walk over there, and I am greeted by a friendly staff. And the staff that was giving me I was given a hard time by my medical plan and my medical insurance, and their staff was crack A, number one. They got on the ball. The red tape was disappeared, and all the nonsense was given away. And my health plan managed to pay for the expenses in my medical plan, which was fantastic. His staff is A, number one. You're not going to be put around and fluffled around and told about different things. Anyway, after I got done with that, now I go for treatment every morning. I make it up to Dr. Lederman's office. I go into the waiting room, and I'm met by other patients that are there and from all over the world. We're talking about the different situations that are going on in the world today, and our cancers and our problems and whatever else is news. And then the staff comes out and tells me I'm ready, and I'm prepared for surgery or for radiosurgery, and I'm put on a table.
There's a lot of difference, right? There's no cutting, no bleeding, no anesthesia.
No,
you walk in and you walk out 15 minutes later, right?
That's correct. I'm giving a beam is fired through a laser that is put on top of my body.
Linear accelerator.
Accelerator. I'm not touched by anything. And then the radiation is done, and the treatment is done. And in about 20 minutes after that's done, I'm told to get dressed again, and I'm dressed again, and I'm left. I'm told to go home and come back tomorrow. And that's what's going on. I usually go to Macy's and then go shopping a little bit afterwards.
Sounds like pretty tough treatment if you go to Macy's and go shopping afterwards.
I said if I went with the surgery over in the hospital, I says I would have been sitting in a wheelchair watching a tree grow. But it's phenomenal. It's fantastic. It's new age. And I mean the cutting and the bleeding and everything else, that's so 1950s. I had relatives that had cancer, cousins and uncles, and they went through it, and they cut off their nose, they cut off their ear, they cut off their lips as the cancer was spreading, and they never got better, and they just deteriorated to the point where they passed away. But this is something new, it's something good, it gives you hope, and I think it's the new age to go. It's something that gives you some enlightenment at the end of the tunnel. I mean, after 50 years of quabbling around with this cancer, I believe that this is something that's going to solve our problem as far as this cancer problem goes.
I appreciate your comments, and I wish you well. And I guess we'll meet tomorrow, right?
Yes, sir. We'll see you tomorrow.
To Macy's.
Yeah, I'm still looking for that suit, Doc.
Okay.
Thank
God
you,
bless
Doc.
you.
Bye.
We're going to hear from our sponsor. We have some other new voices tonight, and then we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super In Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're back talking about a very dramatic case. A man who came to us more than a year ago. A year ago, he came to us with stage 4 colon cancer. It had spread to his spine and back. He was in terrible pain. He'd had chemo and radiation and surgery. He heard about us. He wanted treatment. I thought we had a chance to help him. He wanted to do it, but there was one obstacle, and that was his insurance company. So when people talk about those death panels and stuff, well, in a way, so the insurance company said, look, he's had radiation and chemo and surgery. Nothing helped. He should go on hospice. And it took a week or 2 weeks of back and forth negotiations and discussions with the insurance company to finally get approval to give him radiation. I had to even negotiate on the technique and negotiate on the dose. And there was a woman doctor on the line, and she kept telling me what dose to give. And I said, well, when you give that little dose, he had that little dose before, and a little dose doesn't work. There's radiobiological principles of radiosurgery. What is radiosurgery? Radiosurgery is focused beam treatment to hit the cancer, but to allow us to dial up the dose. When we dial up the dose, the effectiveness increases dramatically. Yeah, you can give low doses and I guess make more money and more treatments, but in cases like this, it doesn't work. That's why we're such believers in radiosurgery. We were the first ones in New York to offer brain radiosurgery. We're the first ones in America, the first ones in the Western Hemisphere to perform body radiosurgery. Finally, after fighting with the insurance company, and I'm dooming fighting, we got permission to treat this man. We treated him in March 2013, 5 treatments to the back with radiosurgery, focused beam treatment, non-invasive in the body frame, in our office, outpatient therapy, and his pain went away, and he did great. And he walked into my office Friday for a checkup 1 year later after being told to go on hospice. Well, he never went to hospice. He had those treatments. He didn't have any more chemo. He didn't have surgery. He had those 5 treatments, and he did great. And now he's back. He wants to be reevaluated. But it's a story about how radiosurgery can change a life. And this was a stage 4 cancer. It was being sent to hospice by his chemo doctor, by his primary doctor, by even his insurance company. And he didn't want it. He refused to accept hospice. So when we suggest to get a second opinion, we mean that you get up, come on down to 38th and Broadway. We'll get your records if you don't have them, and we'll review your case, and we'll give you a fresh second opinion. A fresh second opinion is not going back to your old doctor and saying, well, Dr. Lederman said this, what do you think? That's not a fresh second opinion. That's the same old opinion, and 99% of the time the doctor will say, I thought about it, and it doesn't work. Well, he probably doesn't have our experience. We've been at this for 25 years. We've treated 25,000 patients, lots of patients over many years, continuing to do so, and seeing results like in this man. And very commonly we see nice results, like you heard tonight, the man with the pituitary tumor, the woman with acoustic neuroma, this man with metastatic colon cancer, treat prostate cancer, breast cancer. When you see these terrific results, you're a believer. It's easy to be a believer. And we had another man come this week with esophageal cancer. It had the usual treatment for esophageal cancer. It had chemo, radiation, surgery elsewhere, standard chemo, standard radiation. And now a year later, the cancer grew right back in the bottom of the esophagus, what's called the GE junction, where the esophagus meets the stomach, the gastroesophageal junction. It's growing back. He chose us. We're hitting the cancer with the idea to open up this blockage so we can eat, avoid hospice, and have a better quality of life. We're closing up the show. If you have questions during the week or want that free booklet DVD, call us at 212-246-4237. That's 212-CHOICES. My name's Dr. Lederman. 212-246-4237. We're happy to take your calls. We're happy to meet with you. We're super convenient. We take most insurances, Medicare, Medicaid.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.